Welcome everyone. Let me present my topic on comprehensive therapies of acne, from conventional therapies to microbiome modulation. My name is Hanna Potra. I am a medical doctor and a full-time PhD student at the Department of Dermatology. Here you can see everyone who is helping me to widen my vision. That would be the improved care of acne patients. And I would like to achieve this by the implementation of novel therapies of acne. So far, I have two specific goals. The first one would be the investigation of the efficacy and safety of microbiome modulation in the treatment of acne. Meanwhile, the second one would be about the investigation of the efficacy and safety of different doses of isotretinoin treatment in acne. Let me jump to the first presentation about the microbiome modulation. As you might know, acne is a chronic disorder affecting hair follicles and sebaceous glands. It affects 9.4% of the global population, and this means it is the 8th most prevalent disease worldwide. It decreases the quality of life. It means that 27.2% of the acne population develop depression. It has multifactorial pathogenesis and risk factors, the role of dysbiosis, for example, the Cutibacterium acnes. Among its standard treatments, we can mention topical treatments and systematic treatments. The topical treatments would be retinoids, antimicrobials, and in the systematic treatments, we are talking about the antibiotics, hormonal therapies, and isotretinoin. The retinoids are in the center of the acne treatment, but they have several side effects, such as photosensitivity and teratogenicity. This is the reason why I would like to implement some novel treatment options, such as the microbiome modulating agents, probiotics, prebiotics, postbiotics, and symbiotics that have much better safety profile. Among the disease activity scores, I am mentioning lesion count, global acne assessment score, mean irritation score, and lead score. My aim is to evaluate the efficacy and safety of microbiome modulating agents in the treatment of acne. My clinical question is which is the safest and most effective microbiome modulating agent in the treatment of acne disease. Therefore, I built a PICO framework where I'm assessing acne patients, administering them novel microbiome modulating agents, standard acne treatment, and placebo. The outcome will measure the efficacy in lesion count mainly, the safety, and the quality of life. So my hypothesis is that novel microbiome modulating agents are as effective but safer than standard acne treatment. If this turns out to be true, then this will mean that novel microbiome modulating agents could improve the treatment of acne patients. Here you can see some of my key articles that they are all assessing acne patients with different intervention and comparator, and all of them are RCTs. Here you can see my search key that consists of two domains. The first one refers to acne, and the second one refers to the treatment, and this was approved by the meta coordinator. At the beginning, I started with almost 8,000 articles, and after the title abstract selection, I remained with 91 articles, and the citation chaser added 4 more articles. About my progress, right now I am at the data extraction phase. We started it 1 week ago. Let me continue with my second project about investigating the efficacy and safety of different doses of isotretinoin treatment in acne. As I mentioned before, acne vulgaris is prevalent among approximately 80% of young adults. Oral isotretinoin monotherapy with success rates ranging from 85 to 90%, and its starting dose varies between 0.5 to 1 milligram per kilogram per day. Among its side effects are mostly dose-dependent, such as dryness of the skin, increased cholesterol levels, and potential liver enzyme elevation. So far, we can differentiate two practices, the traditional one and the modern practice. In the traditional one, we were using high doses, shorter treatment duration, and strict monitoring. Meanwhile, in the modern practice, nowadays, we are using lower doses, longer treatment duration, and looser monitoring. So far, we have no consensus on standard dose and treatment length, checkup protocols, reported side effects, summer usage, depression impact, and checkup frequency. So my aim is to assess global practices and outcomes of the lowest effective dose of isotretinoin acne treatment. My clinical question is, what is the safest and most effective starting dose of the oral isotretinoin treatment? Therefore, I built a PICOR framework. I'm working with acne patients, administering them different doses of oral isotretinoin, and I will have two outcomes. The main outcome would be change of disease activity, and the secondary outcome are adverse events and compliance. My hypothesis is that lower doses of isotretinoin are as effective but safer than higher doses of isotretinoin acne treatment. If this turns out to be true, this will mean that standardized oral isotretinoin practices, improving safety, effectiveness, patient compliance, satisfaction in acne treatment. Here you can see a collection. I would like to collect some expert physician opinions about their individual patient data. I will be interested about the treatment details, side effects, treatment, mental health considerations, follow-up monitoring, and treatment discontinuation. To sum up, I would like to end my first presentation until September 2025, and my second presentation until 2026. Let me finish my presentation with the words from Thomas Edison. I have not failed, I have just found 10,000 ways that won't work. Thank you for your attention.
Do you plan to do a subgroup analysis in your first project? And then based on what?
Yes, thank you. If I will have enough data, I am planning to do a subgroup analysis based on different microbiome modulating agents, such as probiotics, prebiotics, and symbiotics.
And in your articles that you already read, are they given separately or combined? And how would you address that?
Usually they are given separately, but not in all articles. Some of them are separately, some of them are together.
I would like to ask, because I'm not in the field, there seems to be a dose-dependent effect of isotretinoin, right? Because you investigate the perfect starting dose for treatment. Can you elaborate a little bit for me how that, generally speaking, works?
Yes, I mentioned that there are two practices, the traditional practice and the modern practice. In the traditional practice, we were using higher doses that varied between 0.5 to 1 milligram per kilogram per day, and this was administered between 4 to 6 months. Meanwhile, nowadays, we are using some microdoses that varies between 0.1 to 0.4%, and we are using this drug for longer. Usually the time varies between 6 months to 1 year.
You mentioned in your outcomes quality of life. What is the measurement behind this?
Well, quality of life is usually measured in my articles based on the patient-reported data. It has a strong correlation with depression and probably it was collected, the data with a questionnaire that the patients answered.
To the first project, how do you see now, which is the most frequently assessed outcome in the articles?
Well, in my first project, the most frequently assessed outcome is the lesion count. This meant that every single lesion was counted on the patient's face, neck, chest, and back. And these lesions could be either inflammatory lesions or non-inflammatory lesions.
My question is about the probiotics in your first presentation or first project. Do they need to be taken systemically to work, like in a form of a capsule or a pill, or can they be mixed into like a daily moisturizer and just applied on the face directly?
Yes, they can be used either topically or systematically. Both ways are effective. Hopefully, both ways are have the same benefits. So I think it depends on the patient which type which you want to choose.
What does the symbiotic means? I don't know.
Symbiotics, yes. They are a compound of probiotics and prebiotics. Probiotics are the live part of them, and the prebiotics are the non-digestible compound that help the probiotics.
I'm really interested in your topic, and I was just wondering, have you found any side effects related to probiotics while analyzing your topics and articles?
Usually they are not reporting side effects of the probiotics, but some side effects can appear, such as abdominal discomfort, bloating, diarrhea, maybe vomiting, but usually only in the beginning of the treatment, because your gut will get used to it, then it's easier to digest.
For the literature you read, does this results report the recurrence rates at follow-up studies, the prospective studies? Do you see this literature like the recurrence rates? Do
Yes.
they report these results? And how do you define the effectiveness of in your second studies?
So
Thank you.
They were usually shorter studies, and the follow-up lasted only 12 weeks usually, so we were not assessing the recurrence in our presentation.
I would like to ask the same question that I asked the last speaker. So, how did these studies control for other factors that could influence the microbiome?
You are referring to,
for example, diet,
yes,
exercise.
Yes, about the diet. The patients had to exclude every probable microbiome modulating food, and they only had to take these pills during these 12 weeks. That was the follow-up time.
Okay, and could microbiome modulation alone be enough for the treatment of acne?
Probably not. They are an enhancer to the standard treatment right now. With my project, we are trying to assess whether it is beneficial only alone or only together with other drugs.